Hey, it's Dr. Jen with the Integrative Health Podcast with Dr. Jen. So I wanted to make a YouTube video and also just put this on the podcast. So I think this is a really important topic. I know I'm talking a lot about this on my Instagram, and it's causing a little bit of drama. It started out with me just saying I'm not a fan of home births. And what that means is I want true informed consent. I want to make sure that people know what the consequences could be if there was an emergency that maybe couldn't be handled at home. And say you were 30 minutes from a hospital, an hour from a NICU, what that means and all of that, because I see the complications in the ER, and that makes it hard for me to be on board with ones that maybe aren't prepared or unsafe, or maybe people don't know what could happen. And birth is such an amazing, beautiful, natural process, and trusting your body and knowing that your body can do amazing things and birth the baby and do it naturally, and have it just be euphoric afterwards and the skin to skin, and it's beautiful, right? So I think you can have all of that. And I did in the hospital, and I was glad I did, because I need a little assistance with my big babies and their shoulders. So anyway, the reason why I wanted to talk about this was how to advocate for yourself in a medical setting. And I think this is really important coming from a physician, and also coming from someone who has birthed babies and has had a kid that was sick in the ER and in the ICU. And I had to advocate for my kids. And this isn't just medically, we have to advocate for our children in their schools, with sports teams, it never ends. So let's go through a few pearls that I think are really helpful. And the first one is bring someone with you. And if they can't physically be there with you, have them on the phone. I have a lot of patients that I find it interesting, because sometimes they ask like, oh, is it okay if they come in? And I'm like, of course. I'm like, you can bring whoever you want, as long as you want them there, because this is your visit. This is your visit. It's not my visit. It's a visit for you. And I am here to serve you as your doctor. And I am so grateful that patients have chosen me, or in the ER, they might not have chosen me, but that they confide in me and they trust me. And I feel like that is so sacred to me, that patients tell me things that are so personal. And sometimes we cry, and sometimes I put a hand on their leg or their arm, or sometimes we can even hug after. And it's so beautiful. And I think a lot of doctors have gotten burnt out, where they've lost this part of medicine that drive them to be a doctor in the first place. So don't lose hope. I hope and I pray that, like, doctors, just if they're burnt out, that they figure it out. They get not burnout, so they can get back to the patient and get back to their heart and why they started medicine. So that was a little sidetrack, but bring someone with you. And that could be someone on the phone also. It's really good to have a patient advocate there. And there's actually, I didn't know this, but there's services, especially for patients in nursing homes. There's people that donate their time to be patient advocates. So if someone maybe really can't advocate for themselves because they're in a nursing home, or they're in a situation where they can't, these patient advocates are going to help with that. So that's one thing. Bring someone with you. Bring an advocate, no matter if it's a best friend, a spouse, your partner, whoever it is, a parent, a sibling. So that's the first thing. Oh, look who it is. Hi, Willow. You could bring a pet even, I guess. So next, do your research. Research the physician, nurse practitioner, PA, whatever kind of provider you're going to see, no matter what it is. Make sure you make sure you know it would be a good fit before you go. And you know what? You might think it's a good fit, and you go there and you don't jive well, or you feel it feels off. And if that happens, you could give them another chance. But if it happens again, sometimes you might just want to switch, and that's okay. I encourage that. You want to make sure it's a good fit both ways, right? And sometimes sometimes it's not a good fit. I've gotten fired. I've fired, primary care doctors, and then I got fired by one. And, that's okay, because if it's not working and you don't feel comfortable, it's not going to work. So the other thing is, you want to make sure that you like the office staff. So the office staff is really important too, because that could make or break, the communication with the doctor. Are they passing on messages for you? Is it cringeworthy every time you call the office? Is it hard to get through? So that's also important. And then specifically for pediatrics and OB-GYN, or if family practice, even if there's an emergency, do you like the partners, right? Do you like their partners? Because for OB-GYN, they might not be on call every day. And you can even ask them around your due date, are you going to be on vacation? Are you going to be out of town? And then if you don't like their other partners, then you're going to have to find a better match. So that's one thing that you have to make sure that do like their partners, because if the partners don't align with you on things, and they're the ones that are going to be there, that could really change a situation and then lead to some trauma down the line. So another thing is get a second opinion. So you are allowed to get a second or a third or a fourth or a fifth opinion. If your doctor finds that offensive, then that's another red flag that, that's weird, right? I think the more eyes on the case, the better. Everyone could give their input and think about what's going on and give their feedback. And it shouldn't be an ego thing. It should be what's best for the patient. So I think that that's a really important thing. And your practitioner shouldn't be offended by this at all. So that would be another thing to see if they're a good fit or not. The third thing, so are you a part of the team? So are you a part of the team, or does it seem one-sided? Are you interrupted when you're in your doctor's office? Do they listen to you? Are they friendly, but they just talk about themselves the whole time and they don't listen to you? Are you able to tell your story? Are you able to share your concerns and have them not be blown off, have them feel validated? So the healthcare team includes the most important person, which is the patient. And a lot of times this gets, the patient gets sidelined. So if you aren't feeling heard, get a patient advocate, have someone come in with you, or change practices. Just say, I don't feel like I'm being heard, or you don't even need to give an explanation. Just say, I'm moving, you could even say I'm moving because this office is closer, it's fine. So find someone, if you're in the hospital, find someone that will listen to you and voice your concerns. So I had this experience with Emory when I was in this emergency room just on spring break. The ER doctor was really submissive. I advocated that I didn't want the high dose decadron, dexamethasone. I wanted the low dose. And because it is a wide range of doses, 0.15, and you could go up to 0.6 milligrams per kilogram. And, I had to really advocate for my son. I finally found a nurse because I told her I was so frustrated and regretting coming to that ER. And she really took the ropes, and things changed after that. The whole visit changed because she actually cared and listened, right? And sometimes you have to find the right person, because not everyone is going to do that. So make sure that you find someone that is going to listen to your concerns when you're in the hospital. And there also, you can ask for a patient advocate there. So regarding the OB care, once again, I have to reiterate, you have to make sure that you like everyone in the practice, because it might not be your OB there. And within a practice, they could have really different views on things. And this is your birth. It's your birth. It's like one of the most important things. And you need to make sure that you are going to get what you want out of your birthing experience. It doesn't mean that it will always go that way, right? But you should be able to advocate and have your birth plan that you want. So some questions to ask OB. I was thinking about this a lot and putting a list together. So I'll go through these and then I'll make sure that I have them somewhere for you guys. So will you let me labor naturally? Will you let me labor naturally? For how long? How long will you let me labor? what if my water breaks? What's your protocol on that? What's safe for the baby? What did the study say? Can I walk around the hospital? Are you going to let me walk around? Or do I have to be bedridden? That kind of stuff. Can I be allowed to eat? Okay. And now I don't know if people know why. Okay. So this is why the anesthesiologist, they don't want, if you have to go in for anesthesia, they don't want you to eat because they don't want an aspiration risk. This is, as an ER doctor, this is BS. We intubate people all the time that ate like at Burger King or McDonald's or whatever before they come into the ER. We can't sit there and be like, oh, hey, you can't breathe. We need to intubate you, but you ate before you came in. I can smell, McDonald's on you. No. So this, for laboring, it's very calorie intensive. It's work. You're working. So, able to eat and drink before, with healthy snacks, tell them, say, this is going to be healthy snacks. This isn't going to be like greasy food that I'm going to like regurgitate up. And this is going to help me in my process for my plan of a natural unmedicated birth, or whatever you want in your birth. But can you be allowed to eat? I think it's a red flag if they say no. I just blatantly said, I'm going to snack if I need to. I'm going to drink electrolytes if I need to during my labor. Can I birth in any position I'd like? So not only labor in any position you like, but birthing in any position, all and on all fours, all of that. Make sure they're okay with it. And if they're not, if they're like, no, you have to be in the stirrups, that's another red flag. No, let's get with the time. Like, let's go back in time, how people, used to labor. Can I have a doula there? Now, I know during the pandemic, this was an issue, and I think this should have been illegal that they were refusing doulas in the OB units. So, and I actually had people on Instagram reach out to me and say that some OBs refuse doulas. They make you sign that in the contract. I think that is inappropriate. That is an advocate for you, and doulas are very knowledgeable. They have to go through so many classes, and it's unfortunate that nurses and OBs get uncomfortable when the doula is there. I've heard of many times the doula has helped and gotten nurses when there was an emergency or something where otherwise the patient would have been unattended. So I think that is another red flag. So my husband and I did the Bradley method, and that was very nice. And then I had a doula, and then I did hypnobirthings. So there was a bunch of different experiences for me. And also, make sure your partner is there and is going to advocate for you. Do I need an IV, or can I have a saline lock? So this is another big thing. Just having a saline lock like on the wrist or something that won't really impede your labor, but what will more of an IV is kind of cumbersome. So see the policies, and also some give Pitocin right after. So just say, what do you give right after childbirth? Do you push Pitocin? Can I not have that? Can I make the decision if I'm not hemorrhaging and, my body is doing what it's supposed to do and the baby's on the breast and the oxytocin's flowing, can we hold off on that? And with my last pregnancy, I said I didn't want it. And the nurse was not really happy with me, but she respected me. I think she was nervous. I was a advanced maternal age pregnancy with Emery. But I told her, I'm like, I was drinking all my red raspberry leaf. My uterus is toned. I am confident. So, that was one thing that I just really did not, I didn't want, and I ended up not having it, and I did great. What happens if I refuse a medication? So that goes with what I was saying. What else? Oh, can we do delayed cord clamping? So that's important. Ask them, do you, or can we do delayed cord clamping, skin to skin directly after? If, there has to be a C-section, can my husband do skin to skin after, or can I? Do you do vaginal swabbing in that case, where for a C-section where they get a sponge in the vaginal area, and then they wipe that on the baby's face? how do you close a C-section? So this was really interesting. I had a discussion with my OB about this. So is it all the layers or is it just a couple layers? So there are all the layers. There's the uterus, there's the fascia, there's so uterus and muscle and fascia, and then subcutaneous, and then skin. And there's all these different layers. And some OBs, they don't close all the layers. So you definitely want to ask. Now, research says it doesn't make a big difference, but my OB, she said that it's best care to suture all the layers. It takes longer, but especially if you want to have a VBAC, which is the vaginal birth after C-section, you want to make sure they're closing all layers. And the crazy thing about this, and I'm like, well, what if they have training and they don't train with an OB that closes all layers? Then that art is just lost. So you want to bring that up and ask about that. And also for the ones on call that could be taking that. And that was one thing that was important to me, is that I wanted an OB that kicked butt in surgery. That loved the natural childbirth, because not all OBs love the natural childbirth, which is frustrating, because I think they got in the wrong profession. But you want to ask them, and get feedback. Or do they kick butt, in the surgery also, just in case there was a situation where you would have to go to C-section. Ask around and see which labor and delivery hospital nurses get the best reviews, right? So you want to kind of figure that out at the local hospitals, because some don't and some do. Now, if you're high risk pregnancy, you might not get an option. You might have to go to a specific hospital, but see if you can get one that is known to have like a better postpartum experience. And then when you arrive at the hospital, tell the nurse that you want a natural labor and ask if they can support you. And they might switch you to another nurse on staff, right? So my last pregnancy, I went in and I'm like, yeah, I want a natural labor, blah, 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 all this. I'm like, I have the arnica washcloths, and I asked my OB if that was okay. We had a crock pot of arnica washcloths. And then, when I was in active labor, she was rubbing the washcloths down over the labia and the vaginal opening to stretch and to help. And it really helped with a 10-pound, 10-ounce baby. So that was great. And I had an amazing one. It was very supportive. Never asked me if I wanted pain medication, because I told her, I'm like, I'm not having pain medication. I've done this before. So all of these things, you want to have that supportive team around you. And that's why doulas are really nice. So you're not just like swayed, right? I mean, you're in pain. You're kind of like, you're not out of your mind, but it's just something you've never been through. So you need that support. So in the end, your medical experience might not be ideal, but you can set the mood and tone by being in control and advocating for yourself, or having an advocate there with you. Okay. So this is hard, right? Like, how do we do this? And I know I'm a doctor and I know I've been in the experience. So that's like, it's hard for me to step in my patient's shoes, right? Even though I have been through similar experiences, I know it's still different for me. So I would say the best thing is to practice the scenarios with a partner, a doula, or out loud with yourself. Okay. Now I'm talking about birthing, but I'm also talking about other situations. So say you go to the pediatrician and they're trying to force things upon you or your child that you do not want or believe in. So in that case, you want to practice those scenarios at home, maybe have some research, have it on your phone, have the studies to bring it up, ask questions. I remember I've done this before at a pediatrician. I'm like, well, what do you think about the rates of SIDS and the DTaP vaccine? And they just looked at me and I was like, I smiled. So here's the thing. Asking those questions, it means you know what you're getting into. It's informed consent. You can have that informed consent discussion. Another great thing, I know I did a lot of visualization with the training, like with the hypnobirthing and the Bradley method. I envisioned my birth. I went through all the different scenarios of birth, opening up, feeling that cervix open, feeling that pain, knowing it would burn, the ring of fire, knowing that the baby would be out after and it would be amazing. The baby would be at my skin, at my breast, right? But I also went through my mind, like, if something would happen, with the monitor, what would we do for the C-section? We would have the curtain down. We would have my husband do skin to skin right away, and then me skin to skin right after. I had a plan, I would ask for not too much fluids, because that's harder with breastfeeding. If you need to have a C-section and then you have too much fluid, sometimes that could inhibit some of the initial breastfeeding. So I had all of this plan, and I was researched, right? So you have to make the time and the plan. And this is just where talking through also with women that have been through similar things, whether it's like birth trauma, because a lot of women have had birth trauma. So I think if two women that had birth trauma talk to each other, that would be helpful to kind of talk through it. I think that if you are going to prepare for your first birth, I would just surround yourselves with positive stories, but then also, be prepared for the other scenarios, like what's your plan B and all of that. And then same thing with, if you decide for a home birth, what's your plan if this happens? If there is something that happened or went wrong, how are you going to deal with it? Are you going to be okay with that decision? All of that, because that could be traumatic too if something happened. So I think all of these are good scenarios to make sure that you are aware of all the situations and what could happen. And then you will walk in super confident, ready to rock it, and you will rock it, and you will trust your body and do amazing. So be prepared, practice, and then stay firm. Stay firm. Don't let them boss you around. And then bring the research too. Like, oh gosh, with the 1 hour glucose drink, I'm like, I'm not drinking that. So I played, the game that the office wanted me to do. And I saw a dietitian, which told me to eat a high carb snack right before bed. So I immediately said, okay. And then I'm like, just to let you know, I'm not doing that. But, I said, thanks, thank you though. I know you probably are forced to say that by the hospital. And I tracked my blood glucose, and they were all great. And I love that. And I had such a good pregnancy, with that. And, it's not just one snapshot drinking a toxic drink, but they also have alternatives for that drink now. So that's good that you can do that. So, basically, I just wanted to share, in the end, I want everyone to realize that physicians really, they do care about you. They really do. Sometimes there are these bad apples, which there are in everything, right? Not everyone is good, but for the most part, doctors really care for you. And if it's not a good fit, or maybe they're having an off day, or you just don't vibe with them, they're not the kind of person you want, and this could be, some people might want a practitioner that's Christian and would pray with them, or, there's so many things that you can look for, in a doctor, in someone that you are working together with health, because in the end, I see medicine as my gift from God to share with others. And I want to, make sure everyone is protected, and also everyone gets what they want with their health, and, working together as a team. And these are very, very hard situations and topics, especially with women in birthing, because in the United States, we are not doing a good job. The C-section rate and the mortality rate of women for the United States is terrible. And this needs to get better. And I think part of that is not, is the communication between doctors and patients. And, patients, if we spoke up and were prepared and pushed back a little bit on some of these policies, like not allowing doulas, or, automatic inductions and all this stuff, that we would see better results. And I love the idea of birthing centers in Ohio, in Northwest Ohio. It's not a thing. And I've brought it up so many times, and I will keep trying to talk to whoever I can about how I think it would be a great idea. for the area, because then you have the best of both worlds. You get a really nice birthing center. I know my friend birthed in one in California, and they had a co-sleeping bed, and it was really cool. It looked like she just had such an amazing experience. And, that's another thing. In the hospital with two of my babies, I co-slept because they just wanted a nurse in bed with me. And that didn't go over well either. Right. So I feel you. I think it's difficult, especially if you're listening to this, you're probably more crunchy or integrative alternative medicine based. So I think that definitely walking that line in between both, so we can just have this beautiful marriage of technology that is there if we need it, yet the innate ability of our bodies to do amazing things naturally. I just think it's so beautiful when they're brought together. And that's my passion. I don't want to be extreme on either end. And sometimes I think that bothers people, because I think that there can be beautiful in the middle. So wrap it up. Advocate for yourself. You are worth it. Your child is worth it. Your spouse is worth it. Especially this is important because I've noticed in medicine, there's things that just get jumbled up, lost, delayed, all of these things. So you are responsible for your health, like no one else, right? We have to take responsibility for our house and our health, right? But it starts at your home. It starts the things you put in your mouth, what you put in your mind, what you're feeding your soul with, how you're moving, your daily interactions with other people. So all of that. So anyway, that's it. So I hope you like this solo episode. And if you did, share it with a friend or leave a comment. I hope it could help just at least one person out there the next time they go into a doctor's office. And please don't be intimidated. Remember, you know your body best, and you are wonderful at knowing your body best too. So have that confidence next time you go in to a medical experience. And I hope it's a better experience also. And to all of those out there that were harmed, have trauma with whether it's a birth experience or hospital experience, I hear it so much. And I pray for your healing, and know that you are not alone, and it will and can get better. Okay. So thank you so much for listening. I will talk to you guys next time.